Molly and Jadene, one of the things that keeps coming up is the question of what were some of the first signs we saw in our loved ones? Because that's one of the big things we all want to know. How do you know? What do you know to look for? What did you see? And I think we're going to find that a lot of the things we've observed and that we saw are going to overlap. So let's talk about that together.
I think when I think about first signs, I have to go back to Matt's premature diagnosis. The things that we were seeing at that point did mimic a dementia diagnosis. I'm very frustrated after the fact because I lost a lot of years of just, cherishing every moment. Not that I didn't cherish every moment, even after the diagnosis, but it changed how I looked at Matt and his life, and I was in a space where I was expecting him to die, within a few years. And fortunately that didn't happen. But we later found out that it was a reaction to a medication that he was on for seizures, and made that change. And, it was like Matt came back. And I think that's, I hate that it happened, but I'm kind of glad that it happened, because it's such a good illustration of why it's important to know what kind of conditions our loved ones might be dealing with. And, we had that episode with Dr. Chicoine about the common conditions that he sees as our folks get over 40. It's just so important, I think, for whoever is the caregiver, the parent, the sibling, to understand that they have to be a detective and be a good detective and rule stuff out. Look at what are things that we might be dealing with that could be showing symptoms that mimic a dementia. Is there a problem with the thyroid? Is there an infection? So that was my introduction. Matt did really fine for a while, but now he's definitely, showing the signs that diagnosis has caught up with him. He's 51 now, and he's, I think one of the first things we noticed was his energy drain. He used to love to go out and go to the parks around his house and take walks in the park. And now he doesn't have the energy and the stamina to do that anymore. We saw some gait issues, where he's stumbling more, and that's increasing. More increased falls, mostly outside, but, some stumbles inside. We've taken carpets up. The throw rugs that were in his house, we've taken those up just for safety reasons. We've had a change in his seizures. He's had a history of seizures, and this was a question I had for many, many years, because I had learned that having what are now called tonic-clonic seizures, what we used to know as grand mal seizures, that those were a very strong indicator of Alzheimer's in our folks with Down syndrome. And I always wondered, if you had seizures before that, would that still be an indicator? Would there maybe be a change in the frequency, or how would we use the seizures as the barometer? And what I learned, Dr. Chicoine and I had a talk one time, and he had said that there may be an increase in the seizures that he does have, and that at some point he probably would have the tonic-clonic seizures, and he has. He's had, I think, 3 tonic-clonic seizures now. So, that's one of the biggest red flags. So, and his affect. He used to, from the time he was a little kid, if we were saying goodbye, he wanted to hug. And I don't know if you guys had this. I bet you did. Like the best hugs. I call them soul level hugs. He can give the best hugs. And then he had this thing about getting a kiss. It was like blowing raspberries. You know how you blow raspberries on a baby? Well, he loved it right here by his eye. I don't know how sanitary it was. We didn't spit in his eye or anything, but, we would make noise on his little face. And he hit a point where he didn't ask for that kiss and that hug when we'd leave.
Aww.
And it took me a while to realize that, but that's a huge one. The other piece of his affect is the FaceTiming that we do. He doesn't live with me, so we do try to FaceTime regularly. And I have noticed that the calls that we make, where he used to be animated and he would make his sounds and noises and, shake his little cat wand, I don't see that as much. And it's like a lot of work on my part to engage him in a conversation with me. So, those are some things that we see. I don't know if those are the kinds of things that you all saw in Kathy and Matthew, or, I would bet that there are some overlaps in those.
I can definitely relate to some of the things you were saying. And like you, we had an early diagnosis. Matthew was 33 years old, misdiagnosed. But we came to find out that a lot of that had to do with the fact that there were several deaths in our immediate family close together. And I think it was a depression issue. He was really mourning and grieving these family members that had died. And they were very good about ruling out the things that you said, though, checking for the B12 deficiency, checking for thyroid. So, we got past that, but fast forward into his mid 40s. We started to see things that were very out of character for Matthew. Matthew was always a neat freak. Everything in his room had a place and a space, and he always kept it meticulous. And that was one of the first signs that we noticed, is that things would just be out of place and his room would look a little messy. And we thought, that doesn't seem like Matt. And then around the house, he was always active in participating in chores. So sometimes he would unload the dishwasher and the forks and the knives would just be on the counter, or the glasses would be set to the side. And it's almost like he didn't know where they went anymore. So things like participating in his chores, not being able to complete a task. We did see that, and I think you said this about Matt, he would have this stare. You would ask him a question or ask him to do something, and it was almost like he would freeze up. He would just freeze and look at you like, I don't know what you're talking about. I don't know what the next step is, what comes next. So that was a big thing for us as well. The thing you said earlier about dressing, Jadene, Matt always got himself up and dressed for work. He worked in the community. He set his own alarm. He would get dressed, come downstairs for breakfast. And we started noticing that he wouldn't be dressed fully. He would put his jeans on, but he would forget to put his underwear on, or he would have one sock on and not the other one, or his shoes would be on the wrong feet. And he didn't do that probably since he was 5 years old, when that's typical for kids to do that. So those types of things, the dressing, the inability to just complete some of these tasks, he would repeat some things. He would stand and brush his teeth, and then he would walk away, and 5 minutes later, we'd see him back in the bathroom brushing his teeth again. Or sometimes he would shower twice, and we would catch him showering a second time after he had showered a first time. So he was repeating some tasks. Another thing that we noticed, and I've talked to some other friends and siblings, that this has been, it seems to be something that overlaps. He would get up in the middle of the night and get ready for work. And my mom and dad would hear noise, or they'd see the light on, and it would be 2:00 in the morning, and they'd walk in and he's sitting on the edge of his bed, dressed and ready for work. And they would have to redirect him and say, Matt, it's 2:00 in the morning. It's time to go back to bed. So he was losing concept of time. And to piggyback onto that, he just, he was, well, not really to piggyback onto that, but a couple of the other things that I wanted to make sure I touched on. His depth perception, when he would have to come down the stairs for work in the morning and go out the front door to get on his van to go to work, his depth perception was changing. He was very afraid to go over thresholds. He was afraid to walk down the stairs. His gait was changing. That was definitely noticeable. His ability to write, he would trace the same letters over and over again and ask what day it was or what do we have going on today, because he would fill out a weekly schedule. He knew what his weekly schedule was. And then the biggest thing that was so noticeable for him, like you said, Jadene, was his affect. The affect just kind of flattened.
Mm-hmm.
And, you know, we knew Matt was still in there, but that interaction and that affect was, he became more withdrawn. And that was heartbreaking. It's just heartbreaking to see these changes because you're so used to them being a certain way and you're so used to them having whatever level of independence they have or what they had, you know, reflective of what they were doing at the time. And then some of those skills start to change or lessen and decrease. So those were the, you know, top 10 things, if that's how many I said, that really stood out as what we saw at first. It wasn't the memory issues. That's, you know, that's not what happens most of the time in our loved ones with Down syndrome. You don't see the memory issues. They're not forgetting who you are. They're not forgetting all of the everyday things that we anticipate. These are the things that we see happen a lot. Molly, can you relate?
I totally can. For us, for Aunt Kathy, I can answer that question in probably 3 distinct ways. We had no idea that Alzheimer's was in her future. We did not know of the connection between Alzheimer's and Down syndrome. So at one point, I think Kathy was like 56, maybe. Her staff had mentioned Alzheimer's to us, which was a shock. And, you know, I couldn't for the life of me figure out why they jumped to Alzheimer's. They had said something like, you know, she had forgotten to come down and get her medicine one time, or just some like little things. And it seemed weird to me that we would jump to the conclusion of Alzheimer's because, like you said, Kristin, I had in my mind Alzheimer's as forgetting people and forgetting things. And she was only 56. And I was like, what are you talking about? That's such a weird thing to jump to. So after they had said that once or twice, I started to look into it and was horrified to find out that, oh my gosh, there really is a connection between Down syndrome and Alzheimer's. At this age, we need to really start looking into this. So we took her to a Down syndrome clinic a few hours away to have her evaluated and looked at. And one of the biggest things that we had said we had noticed over the past few years was this dulling of affect. And my mom had said, you know, I'm worried that she might be depressed because that's just kind of how it presented, you know, a little bit lower keeled, not as gregarious, not as emotive. However, she was also a little bit quicker to tears than she normally was, but just that dulling of affect that was presenting as depression. Her processing speed had slowed down a little, but at that clinic, they had told us, you know, she's fine. Start looking for changes. That's going to be the telltale sign. Over the next year or so, we started noticing, you know, she was increasingly not able to get to work on time. And again, for a while we had thought, oh, well, maybe she's just not sleeping well, or she's not getting up early enough to complete her morning to-do list. You know, maybe she's being stubborn. Maybe she's dropping the ball. Like, we just need to surround her with a little bit more rigor. She needs to get up earlier, whatever, but she wasn't making her bus in the mornings. So I would say, looking back, that plus the dulling of affect were probably those first signs, but I only know that with hindsight now that I know more. The time, I think, when I really knew for sure that this was different was when she started mixing up her directions. She would go down the wrong hallway to her apartment. That never happened, right? Like, she lived on the third floor. She would go down the hallway on the first floor. Or when she went out of her elevator, she would turn left instead of right, you know, that kind of thing. And Kathy was great at directions. But again, Kristin, very similar to Matt, her apartment started to get really messy. She was really neat with putting her clothes away, but she started hoarding all of her, like, the mail that would come or bulletins from the church or things like that. I mean, just like piles and piles of paper and paperwork that she didn't want to get rid of and couldn't find a place for. She was a little bit more easily confused. Those were I think the very earliest signs for us. She did have a lot of the things that you talked about, Kristin, with Matt, like the depth perception, something that they called perseveration with her writing, like repeating the loops. And it's almost like she was stuttering with her writing. But that happened more, I'd say, towards the middle stages for her. But yeah, and early on, she was confusing we already knew that she had it at this point, but it was still in the early stages. She would get mixed up with her days and nights. She would go out and wait for the bus for work at 10 o'clock at night instead of 10 o'clock in the morning, that kind of thing.
You both mentioned signatures or writing. Mm-hmm. Matt never learned to read or write, but he did at some point. I can remember years ago where he would have to sign, an X on the documents for the state for his funds and stuff. And he managed to make some lines that sort of, if you really used your imagination, looked maybe like an M. And he made kind of a circle that, if you used your imagination, looked like an A. And then there were a couple of crosses. And he did that for a long time. And then we got to where we just got the T's. Then it was one T. And, last week was my older grandson's graduation. And Matt bought Aiden a graduation card. And he brought it up here to the house so I could take it up when I went up. And I had him sign it. And he just scribbled. It was just a bunch of, there wasn't anything that resembled any of the letters in his names. It's just a scribble. And it was like, whoa, that was a big one, because Matt loved to write his name. He hates signing papers, but he liked writing his name. That was interesting. I have a question, something else that's been occurring with Matt since, the more recent period where, I feel like we're really in this Alzheimer's journey, are choking incidents. Because my understanding was that because of their low muscle tone, they can't use their tongue as well to sweep food to clear their mouth. And he used to do that pocketing of food. Well, he still does. The pocketing of food, we used to call it chipmunking, because he would, get food pocketed along his jawline and in his cheeks. And that's gotten to be more of an issue, to where we've actually had some choking incidents. One time a staff actually had to do the Heimlich on him because it was that bad. Did you all have anything like that with either Kathy or Matthew?
So Kathy didn't choke, but we did have to modify her diet as the disease progressed. However, for Kathy, that was towards the end. Do you know what? Actually, she did have a couple choking incidents before that. And okay. I'm going to totally change my answer. Isn't it funny how the memory works? Okay, so she did have some choking incidents. And so I did start making things on purpose easier for her to eat. I had to do the Heimlich on her like twice. And she was so cute because I also I wanted to save her, but I didn't want to scare her. So I was panicked and did it, but also was smiling and like, it's okay.
Aww.
And both times she was so cute afterwards. And she said, "Thank you for saving my life."
Oh, how sweet.
Aww. It was so sweet. And she gave me the biggest hug both times. So I felt better. I knew she wasn't scared. And I was apologizing the whole time I was doing it because I know I was hurting her. Anyway, that's a story for another time. So
yeah. And we had the same, ours was a very gradual thing with the swallowing and choking incidents and having to change Matt's diet, but that definitely came in the later stages for us. That was not one of the early signs or symptoms. But I do want to go back to the early stuff here, because we've talked about so much the importance of documenting and noticing these changes. And I will say one thing that my parents did an excellent job at was documenting the early signs and taking videos for the doctors and showing his caretakers or doctors or, siblings, my brother, me, just because when you're in it, sometimes it's hard to remember the timeline, and it's hard to remember what did they start doing first or what came next. And so one thing I would say is, anybody that's listening, if you think you're starting to see changes, start writing these things down. We've talked about in some of the other episodes some tools that are out there to get this baseline and checklists that you can use, because it does all kind of blur together at some point, and it is hard to remember. And when, we started talking about this, you do have to go back and think about what were those first things, because something made you look at Matt and Kathy and Matthew differently and say, wait a minute, we got to put the brakes on here and let's take a minute. And sometimes you think, am I just imagining this? Is it really happening? Right? Because we're in different stages of it. And
Right.
Molly, you brought up a good point that, and I think this has a lot to do with it too. You didn't know about the link between Down syndrome and Alzheimer's. That had to be a huge blow for you, right? When you learned about that. And Jadene, you had knowledge of it. We had knowledge of it. So it was always in the back of our mind. Is one of these things that he's doing going to be the day that we say, oh my gosh, is this the start of Alzheimer's for him? So I think that's really important to bring that to light, that not everybody is aware of this connection. And that really can be a double whammy when you're dealing with these. And then emotionally, you have to wrap your head around this.
Yes. And to your point, if anyone's listening who hasn't started seeing signs yet, also start documenting, right? Because the baseline is so important. And we'll put a link to that screening tool. It's never too late to start using it, but the best time to start using it was a year ago, right? Just to get that baseline of normal and normal level. But before we wrap up, because I think we've got a few minutes left, I want to ask both of you a question, if you don't mind. It might be a hard one. Both of you had premature, incorrect diagnoses. What changed in your own perception of their decline that made you know now the diagnosis is correct? Is there something, or is it a gut feeling? How is it different the second time?
I think for me, that change in affect was concerning. And, I went all those years. I went in, I think it was 8 years maybe, from the premature diagnosis to me going, he doesn't have this. And then I had a couple of years of, he's living his life. And then I started seeing stuff. So when the affect was changing, I started to think, could this be? And now you're just, because I'd spent all those years thinking he had it. So I didn't want to go back there. The change in energy, when I found out at one of his quarterly meetings that he was napping, it's like, Matt never napped during the day. And the staff didn't know. They thought this was normal for him. And it's like, no, him needing a nap. And now he's at a point where sometimes he can barely get his little fanny in the chair and he's asleep. And that is so not him. But the real thing was when he had the tonic-clonic seizure. It was like, that's it. There's no denying this now. That tonic-clonic seizure it sealed the deal for me.
And in the past, you've talked about how that 8-year period, there weren't a lot of other changes, right? He was
Correct.
kind of steady, right?
Yeah.
Okay.
Yeah. And, we've got the Facebook group, and that was kind of my barometer because, I would be seeing families posting about these changes. And, a family would join us, and in 6 months, they're talking about huge changes, and wasn't happening with Matt. And I was like, what's going on? And so, yeah, him not seeing changes and stuff for a long time, I still believed we had it and he was just moving slowly. And then I finally was like able to say, this isn't Alzheimer's, it's just Matt. And he wasn't really declining. We weren't losing things. And then now we are again. Now we are. Not again, we are.
Yeah. Kristin?
For me, I would pinpoint it to three things. First, that sibling connection that I always had with Matthew from the time I was a little girl. It's kind of like, as a mother, you know your kids. You know your kids and you just know when something's not right. As a sibling, we had such a deep, strong connection. I just felt in my heart of hearts, because I had known what I had known and learned about Alzheimer's and Down syndrome and the connection. I just started to have a gut feeling that things were changing. The most poignant memory that I have was when my mom told me Matthew was getting ready for work, and he always showered himself and got ready, and she heard the water running a little bit longer in the bathroom, and just the bathtub water. And she gave it a little bit of time. She went in there and she found him just crouching by the faucet, and he looked up at her and he said, "What do I do?" And he didn't know what to do. He didn't know how to turn the shower on. And that was just like gut wrenching for me. So
Ugh.
I remember that moment specifically when my mom said, I think we're getting to that place now. And like Jadene said, the third thing, which, because at that point I was in acceptance of it, and I believe my parents were more in denial of it. Then Matthew had the tonic-clonic seizure several years later. And that's when the doctor said to us, we know this is a confirmation of the diagnosis. And when these tonic-clonic seizures start to happen, we also know the disease is progressing at a faster rate. So those were the big things that stick out for me.
And it's important to note that tonic-clonics are not a sign for everyone. Kathy never had a tonic-clonic, and she did.
Correct.
She did not have any seizures whatsoever until the end stages.
Yeah, so I do think it's so important to, if you're not seeing any signs, start documenting anyways. If you are seeing changes and signs, keep documenting. Take videos, take pictures. Even pictures of their face can show the affect of what they're showing you and telling you where they're at. But I really do think this conversation was important, because the more I talk to people, the more so many of these same things come to light. Jadene, you talked about the napping. That was one I forgot about. Matthew didn't take naps frequently, and then he started taking naps more often. That was another sign for us. So sometimes these little things. However, the big thing is make sure you're ruling out anything else
This is
that
what
it could
yeah,
be.
right.
Right? Make sure.
I think you both are examples of that. It's a clinical diagnosis of exclusion,
Right.
Mm-hmm.
and that's a big takeaway here.
Yeah.
Signs are signs, right? But
Yeah.
we've got to rule out anything else that might be treatable, because there are so many
Right.
things that are treatable that masquerade as dementia.
And that's the big difference. That's the big difference. If it's something that could be treated, then they go on with their life. But if it's a true dementia diagnosis, there is no, and there are medicines out there. That's a whole nother topic. Matt's not on anything that's related to a dementia med, just because of the research I've done. But there is no cure. That's the bottom line. This is a terminal diagnosis, and so, yeah.
Yeah. And then and the approach we take then, once we have the diagnosis, the approach you take and the mindset that you put into it can make all the difference of giving them the best quality of life and loving them to the fullest, and embracing what feels and is a horrible thing, but also what I found to be was an honor and a privilege to love and care for someone in this journey. So I hope this helped people that are listening. I hope it hits home for some. And as always, we welcome any comments or questions and things that we can continue to talk about. If there's more of this people want to hear about, that's why we're here.
Absolutely.
I can hear the music going out when Kristin said, I forget what you said before that, but anyway.